and now we are going to see individual disorders. So today we are going to see panic disorder. Panic disorder is also known as episodic paroxysmal anxiety. So from the name you can understand it comes like an episode, and that's what you can get from this name. So the main feature of diagnosing of panic disorder is recurrent panic attacks. So that is one of the important thing, recurrent panic attacks. So you should know what is a panic attack. Now I can tell you, if you ask a patient with panic disorder about his first panic attack, it's almost sure that he'll be able to clearly describe the time, date, the event, everything, because it is such a terrifying experience. You should really ask a patient with a panic attack how it was. It is like one of the most terrifying experience. Now there are some features of panic attacks. One, it has an abrupt onset. Panic attack usually happen abrupt, so like an abrupt sudden onset. It usually occurs in unpredictable situations when there is seemingly no apparent danger. So that is another feature. It occurs abruptly, suddenly. It may occur in a situation when there is seemingly no apparent danger. Sometimes you may be sitting in a class, sometimes you may be walking, sometimes you may be sleeping, sometimes you may be traveling in a bus, etc. And suddenly these symptoms happen. And when it happens, it peaks in few minutes. Within few minutes, maybe says like 4 or 5 minutes, it reaches a peak. It lasts for several minutes, say like 15 to 20, 30 minutes, 15-20 minutes it lasts, and then it gradually settles. So this is known as a crescendo decrescendo pattern. That is, it comes, peaks a minutes, lasts for several times, then may rise. So this is known as crescendo decrescendo pattern. But during that period, the subject will be having an intense suffering during that period. Subject will be really fed up with that period. It will have an intense suffering. That few minutes or 20-30 minutes will be a period of intense suffering. Now, what are the symptoms? So DSM-5 has mentioned about 13 symptoms, and they say that 4 or more should be there. So among these 13 symptoms, 4 or more should be there. That is what DSM-5 says. You need not remember like in the chronological order the 13 symptoms, etc. But you should have an idea. For that, you should know that these are mainly somatic or autonomic intense symptoms. So when I am going to tell you the symptoms, when you see, you will understand that these are mostly somatic and autonomic intense symptoms. So let us see what are those symptoms. One is palpitation. The subject will feel that the heart is pounding like anything. Next can be sweating. There will be sweating or drenching of sweats that can happen. There can be trembling or shaking. The subject will feel like intense feeling of trembling or shaking can happen to subjects. There can be breathlessness. The subject will feel like a shortness of breath. The breath is going, or shortness. A shortness of breath will be there in that subject. Then there will be choking sensation. There can be chest pain or chest discomfort. There can be nausea or abdominal discomfort. Sometimes what is told like butterflies in the stomach. So subject will feel like something turning around or butterflies like sensation in the stomach. So that is there. There will be dizziness or unsteadiness. The subject may not faint, but they feel like feeling going dizzy or unsteady. This can happen sometimes in these individuals. There can be chills or hot flushes. There can be numbness, that is, or paresthesia, that is, tingling sensation, etc. The subject will feel like paresthesia or numbness or tingling sensations in the body. Two other words you should remember is derealization and